Elon Musk or Mark Zuckerberg? Who do you prefer and why?
Could I have a third choice? Because you actually have to work with the client to better understand what their needs are, as opposed to them telling you. It's really important for you to actually sit down, as you pointed out, and really walk them through.
And I feel text messaging is the best way to communicate with patients,
Yeah.
with doctors. I think that seems to be the fastest.
Well, the key one for me is to start the day is I try. But what I do is I try to actually exercise every day, start off the day, just to sort of reset myself.
The best entrepreneurs or leaders in any space, they are able to combine two different fields together. Hello, ladies and gentlemen. I'm Dr. Umer Khan, and today we have Mr. Howard Rosen, who is the CEO at Nova Insights. He is an innovator, a solutions architect, a thought leader in the health IT space. Howard, how are you doing today?
I'm doing great. Thank you. Great to be here.
Excellent. Howard, it's a pleasure to have you here. And we've been connecting on LinkedIn for a while, and we thought that
Yes.
with your vast experience, we definitely need to get you on board. Can you give me a brief description, a more elaborate description of what you have been doing over the past years?
Well, I guess I have, what we say, a less than traditional route in terms of certainly health IT. Very quickly, the story is, and I'm sure it's familiar to many who've done the same thing. I was educated as an MBA, trained run a Fortune 500 company. Naturally, with that background, I spent about 20 years producing film and television, which is the natural segue into health IT, where I am today, which is almost 20 years now. It's 19 years that I've been involved in this since I came up with this idea that led to my career.
All right, that's interesting. So, was that sarcastic? That film and video production leading into health IT, was that a sarcastic remark?
Actually, it was. You know what? Had you asked me then, I might have been, but no. Now, actually, the reality is the connectivity is my job. Really, as an MBA, I was trained to engage customers. In as a film producer, my job was to engage audiences, and really, what my invention or my communication platform was the whole point of it was engaging patients and providers to communicate better between themselves. So the reality was, I wouldn't have been able to come up with the idea if I did not have the film and television background and looking for
No,
ways to
yeah.
engage.
No, that's surprising because the best entrepreneurs or leaders in any space, they are able to combine two different fields together. And if you're only in healthcare, right? So you only have a unidirectional way of thinking about things. Now, if you have a different background, you can bring all of this together and produce a better product that encompasses a lot of different aspects of what you want to do.
Exactly. In fact, the statistic that's helpful at all is exactly that, which is I read, and I've been trying to get back to the source, where 80% of innovation in any industry comes from outside that industry.
Right. So, how did you see this? Was it difficult for you to combine this? Of course, you had the MBA background and you had the video production background. How did it actually fit into healthcare?
Well, I said one thing, it helped. I was younger and didn't know any better. In part, really where it evolved, I won't bore you for a moment with the details, but I was working on expanding my company to the area of education and training, the film company. And my client was GlaxoSmithKline, and this is around 2005. And we're doing a piece on type 2 diabetes and learning how pervasive it was and how pervasive they anticipated it to be. And really, it was looking at what solutions were being used then, and they sort of said, well, this is what's being done. I said, well, they're great, but only 18% of people were using these solutions. So, kind of being a card carrying, arrogant producer, I went, well, all you got to do is come up with a way to engage patients to involve themselves in their healthcare, and they'll take better care of themselves. And that was that fair. Okay, I've solved diabetes. Don't have to worry about it anymore. And didn't think about it. And 6 months later, I was actually working a promotional campaign with Motorola for a new cell phone, and this is 2005. And they sort of said, well, sometime in the future, you're going to be able to put programs on telephones and do things like tell the weather. And we said, oh, you're crazy. You can never use a cell phone to tell weather. But literally that evening, I kind of thought about those two things more. And well, maybe cell phones are going to be that way to engage people to better manage their diseases. And that started me on my odyssey.
No, that's fairly interesting because you're absolutely right. A lot of these chronic illnesses, it has a lot to do with the individual person, and
Yeah.
we put a lot of burden on the healthcare system as such to improve outcomes. There has to be participation of, by the end user, and that is, if you can't get the end user to actually be involved and be engaged, it's going to be very, very difficult. And I mean, it has led to the obesity epidemic, the diabetes
Yeah.
and whatnot, the heart disease, everything that is currently so prevalent. um, and why did you, I think you mentioned it, but why did you choose diabetes? Did you fall into this because it was convenient and you were already working on this?
It was really because of that the continuing medical education piece I did, because it was GlaxoSmithKline, and I learned about diabetes. I said, well, okay, maybe it's diabetes is the area to zero in on. I really, literally, I came in there knowing nothing. I was truly, whatever stereotype you want to give for a film producer, that was me when I went into it. I didn't know what this was about, but I learned that the idea came about because of this diabetes project, and that's what I zeroed in on. Now, I
Right.
certainly subsequently learned how, obviously, how pervasive it was, and how truly important it was to be involved with that as the first start. But it was also very helpful because it was most complicated because of the degree of engagement you need to have patients. So I was coming up with this communication platform to help them engage. It was dealing with all the tremendous comorbidity, all kinds of issues that were exceptionally complicated in that population.
Right. So you mentioned a few challenges that you encountered. And in the health tech space, can you pinpoint a few specific challenges in engaging patients as well as working with clinicians or providers? Because this space is filled with challenges, and but how did you overcome these challenges?
Well, I guess the first, and obviously there's a lot of research and work I did as it came up and this idea evolved. But fundamentally, it was because of my background, to your earlier question about engagement. The key thing I thought was the first thing to do is reduce the barriers of communication and the barriers of engagement. And at the time, and frankly, still today, a lot of times the health system and solutions are telling people how to communicate. They're telling them, you got to do this, you got to use this machine, you got to use this device, you got to use this app to communicate. And that's, you're immediately going to have people push back because people want comfort. If you want to do something that's complicated, you got to give them their comfort. So let them do what is best for them and what is easiest for them. So my whole concept was to allow the patients to determine how they're to communicate and with what device they wanted to communicate. And don't tell them you have to do this because there'll be enough they're being told. So reduce those barriers of communication. On the clinical side, these are all generalities. On the clinical side, frankly, the biggest pushback was, how do you deal with a fire hose of data and information that a clinician can possibly get now with this kind of approach? Because now the patients say better communicate, you can get more information, but the clinicians don't have the time for more information. They don't have time for discern what all this was. So at the same time, we had to come up with a solution that actually went through and provided the clinician with the information they needed when they needed it as well. So similarly, dealing with their engagement issue and their barriers of communication to give them what they needed. So you had to be in any solution in health tech in general. It's not just I'm going to help the patient, I'm going to help the clinician, I'm going to help the nurse. You've got to be aware of the entire ecosystem that you're dealing with and make sure that each stakeholder in that process is having their issue addressed and provide and solved in that process. As otherwise, that solution flow is not going to come through. It's not going to work because each one will be a friction point and a barrier to success.
No, you're absolutely right on this because, especially in healthcare and with any entrepreneurship journey or any target market or target audience, and you really hit the nail on the head on with this one, uh, that you really have to get the end user involved. And in this case, the end user is the patient as well as the clinicians, as well as the providers and the doctors and the nurses who are involved. And in healthcare, it makes it especially more challenging because it is so multidimensional, as you mentioned. And for any healthcare startups or founders out there, you have to really look at your tech product as a replication, how it can replicate the on the ground situation, and that is going to be hugely important. And especially with a disease like diabetes, where the variables and interactions or insights or readings are multiple times a day. So you have to really meet the people where they are and try to replicate that environment and see how where are the issues issues and identify those issues and see how you can aptly control for them and aptly provide solutions for them. Um,
Exactly.
is that
And
what
in
you
fact,
felt when you first yeah.
as I learned and sort of got educated, in all these particular areas, and frankly, that's why the whole area expanded into behavioral health. So it's just chronic diseases, but also behavioral health for the same because they're all many of those same kind of fundamental issues.
Right. Can you talk a bit more about that? How was behavioral health incorporated, which is of course a huge aspect of it? What aspects did you get into with this?
Well, what part of it was, it really came down to an opportunity set. Like we were working, the early days showing what we can do with diabetes, and we had an opportunity to actually work with the VA, actually an NGO outside of California, dealing with uh, veterans suffering from post-traumatic stress and subject to high-risk suicidal events. And so we were asked, can we take the same approach, obviously using the assessments and clinical approaches for PTSD and high-risk suicide, but that same communication approach off my platform. And we did, and we had a fair success to the extent that we were able to help the veterans, and that's how it sort of evolved into this broader behavioral health approach.
So data gathering is first. You have to really know the people who are you're dealing with. You had questionnaires, you had patients' past medical history, you had their records integrated. How did you go about collecting your data, and what advice can you give people going into the health tech space where you're directly dealing with patients? What advice could you give people?
Well, the key thing is twofold. One is we're dealing with patients, but with our clients, whether it's the VA or health, whatever health system it is, we're creating that bridge on their behalf. It's that last mile communications, that approach. And so we're still providing them the insights and the care that they got from the provider, but we're creating that bridge to allow that deeper communication insights. And so in terms of data collection, it's first of all a comfort to share the data on the patient side because that's a lot of data. It's very personal. So you want to create an environment where they feel comfortable. And at the same time, you're satisfying. And so, as I said, let them use whatever device they want, communicate however they want to do it. So you've dealt with that barrier. But now you're dealing with a whole wealth of information that's being collected. And you also have to make so you deal with the ease of use. But then the other side is security and privacy. So you got to deal with the security and privacy element to make sure the communications are secure and the data collected is secure, and to have again it's the comfort on both sides, comfort on the stake and the clinical side, comfort on the patient side, that information is being kept secure, and that the information they're getting is also getting to the clinician. So when they get a response, it's not a generic, oh, just make sure you exercise today. It's very specific to their personal needs. So in terms of data collection, is you want to basically tie all this together so the patient gets very specific, very personalized information and or courses of action that is helpful. The way I talk about in generalities is you don't want data, you actually you want actionable information. And those are two very different things.
So with healthcare and this project that you're specifically mentioning, how do you put it all together? And as you just mentioned, that you have to filter out the aspects that you need from all the noise. How did you actually go about homing in on the details that you specifically need?
Well, first and foremost, it starts with the clinician because they know their patients and they know the practice or the system better than I do, or my team does. So we work with them to say, okay, what is important to you? What information do you need? And what would be the most valuable to you? So instead of seeing the patient every 3 months, if something were to occur, it basically go through a whole process, but something would occur, what do you want to know now? What do you want to know at the end of the day? What do you want to know at the end of the week? What do you want as a summary at the end of each month, for example? And we really go through that analysis with the clinician to sort of say, okay, which are their protocols. At the same time, there are a number of validated assessments out there and protocols that exist. So we do a comparative as well and working with the clinician to see what makes the most sense for them and to make sure we're using validated instruments at the same time. So the collection of data, whether it's off of a medical device or a Fitbit, or it's whether it's patient generated data, that's satisfying all those elements. So there's a lot of work. There's a lot of back. The thing is, there's a lot of
Yes.
background work required to get it up and running. But once it's up and running, you could scale. It's designed. You have to be able to be scalable. So that's the third prong of all this thing. It has to be scalable. So it's the contradiction of personalization and scalable.
No, definitely. And I think you're absolutely right in this. And when I work with startups or advise, I've seen numerous startups. They are trying to get into the health tech space, but they haven't talked to the patient. They haven't talked to the doctor. Or if they have, they just got a few questionnaires filled, and they are believing that that's what it is. No, in health tech, you have to get your stakeholders involved from the very beginning, and it is going to be an iterative process moving forward
Exactly.
also, because you really need to get to the bottom of what is needed by the patient, what is needed by the doctor, what is needed by the nurse, what is needed by the case manager in the middle, what and you really have to meet your target audience right, really close, up close and personal. And it will happen that the doctor is busy or the patient is busy, has things to do. um, th- but you have to find ways to incorporate your these significant people's persons of interest into your designing, your development, your ideation phase. It has to. And as Howard has been talking about this repeatedly, I'm trying to home in on this point, that is why it's so important, especially in healthcare, to get this right. Otherwise, you may be looking for the wrong thing, you may be getting data that you actually don't need. And with all the noise and all the noise, you need to really home in on the exact things that you need. So yeah, Howard, that's great that you are repeatedly focusing on this point. And for everybody out there who is looking to get into health tech, um, is this one of the bigger advices that you will give people?
Well, without question, fundamentally, it's in terms of all these things in innovation, it's great to have homed in on the problem and a solution to that problem. Terrific. That's great. That's a big first step. The second one is, and you articulated very well, but is this the stakeholder or your intended client? Do they see that as a problem as well? And do they see that as a solution to that problem? And if they do, okay, you're step two on all that. Step three is, do they rank it as important as you do as a problem? Because they have, again, as you know, clinicians have so many problems they're facing with providers on a daily basis. So you may have identified the problem, but you know what? That's number five on their list. They only have time to solve one and two. So unless the problem you've identified is number one or two on the priority list, it's just not going to be addressed. You'll get a lot of pats on the head. You'll say, that's really cool, that's great, but it's a problem, but not the biggest problem I got to deal with today. So you really have to zero in on not just only the problem and affirmation that everyone agrees that's the problem, but you got to make sure that's actually a priority that has to be resolved.
Right. So you mentioned right now that, for example, in your situation, you are working for a company or a vendor perhaps, and they're looking at something from one viewpoint. If you notice that, okay, this viewpoint may not be the most accurate, and with your assessment of the field and on the ground and getting your feedback, if the feedback that you're getting and the idea that you have in your mind may be contrary to what the vendor or your client is actually wanting you to do, how do you go about handling this tricky situation?
Well, it's interesting because almost in any situation you run into exactly like that is the vendor or the client you're talking to, they don't know what they don't know, and they know what they
Yeah,
hear,
can't.
around them. Like right now, everything is AI. And so your job, to your point, is to sort of actually to listen to say what are they saying, not what they say this is my problem, but actually to get a better sense of what the issue is. And then working with them, we can come around to say, you know what, this is the issue, but you know what, the problem is X, not Y. And it's really just work. It's a whole process of working with the client. So as an innovator or product, you actually have to be a consultant because you actually have to work with the client to better understand what their needs are, as opposed to them telling you. It's really important for you to actually sit down, as you pointed out, and really walk them through what that actually need is, and have them to understand the comfort that you understand this process. As I facetiously joke that I can go
Definitely.
into any client and I may not have any background on them, but the one thing I know going in there, whatever they tell me is the problem, I know that's not the problem.
Right. Unless you actually go deeply delve into the problem and ask a few questions, only then will you realize that okay, so maybe you need to tweak your question, your hypothesis a little bit so to actually deliver results.
Exactly. Exactly.
Right. So to, you got into this back in 2005. Now it's going to be 2025 in a year now. So how has this changed? I know a lot has changed in the last 2 years, but with your constant involvement in health tech and bringing out new products, how has this changed?
Radically in terms of technology, but the problems haven't changed. You're getting more people still have illnesses, and the clinicians are stressed. There's no time, and there's no, and limit, not that much money at giving the amount of work that has to be done. So, but what's changed though are the tools, the ability to support the clinicians and providers to be able to sort of go. You don't have to be in person at the same time. You can go virtual in a lot of elements. Like we found from our clients, literally 93% of the time you could automate entire processes without any issue. But 7% of the time, the patients needed to see the provider, the provider needed to see the patient. The key is having the ability to discern who those 7% are. So there's a lot of very sophisticated tools to help make and simplify and to hone the system. So in terms of the comparative from 2005 to now, remember 2005 when I said you should use a cell phone and use text messaging as a first stop for engaging patients, people thought I was crazy. I literally get laughed out of offices. So today that's a different story, but the technology has changed dramatically. Now they'll laugh at me again, use text messaging when you've got so many other ways. But the whole thing is to be able to use technology. You can use technology to better get a sense of how to better discern what patients' needs are, to actually support patients, to have patients better engage themselves. Where before it was really just the ability to engage was very limited for patients. Now the tools are dramatic kind of tools that they have, where they can actually better understand what their situation is and better self-manage in many areas where they can, and clinicians the same way. But at the same time, that ability makes it eminently more complex. And back to the point, fundamentally, the big fundamental problem is the fire hose of data. That's probably the biggest benefit and biggest problem that's come out of all this is that management of that fire hose.
Yeah. I mean, the biggest thing is acceptance. Initially, back in the day,
Yeah.
there wasn't that much of acceptance was a problem. But COVID, of course, pushed us through so quickly that now everybody expects that you go to your doctor, a primary physician, or you go to a hospital. You expect that they have a program that you can communicate. uh, you don't have to come to the hospital, you don't have to pick up a phone, there has to be a different way. There's a text messaging system. You have notifications on your mobile application. So people are expecting this, and extending this beyond, people are wearing devices and wearables, and people are used to receiving inputs. And personally, work with a few startups who are in this space that are providing
Mm-hmm.
information, real-time information to the patient based on their digital watches. Forget about hardcore medical devices. So now the acceptance is the main. And I think you mentioned about text messaging, and I feel text messaging is the best way to communicate with patients,
Yeah.
with doctors. I think that seems to be the fastest, the most accessible. I don't know what's your thought about that.
Well, yeah, I've been using text messaging for 20 years into my solution. So, yeah, I'm definitely there. And only because of the ubiquity, because everyone texts. So, again, the ease of use, people are familiar with text messaging and it works. It's robust. Everyone does it, knows how to use it for lots of reasons. The issue of acceptance, it's actually a very good point. Patients have always accepted finding different ways of communicating with the healthcare system, whatever it was, whether it's email, go online, just as they did with their bank, just as they do in going online to buy stores. It was the health system that was the resistant one, frankly, to a huge way. There's a lot of talk about we want to be innovative, but the reality was they weren't, and a lot of pushback, frankly. And COVID has made a difference, in part because they also got reimbursed for it. Sadly, part of the metric, not all, the part of metrics is mathematics and revenue, and how do you get paid and reimbursed. So that is part of the issue as well in this mix, is the reimbursement of whoever's in the system, whether it's the provider, whether it's the technologist, whether it's the incentive to the patient. That becomes part of the acceptance model.
Definitely, yeah, yeah. With a for-profit system, it's you got to think about it in a way, from a humanistic standpoint. The main incentives are not even better patient outcomes. I would even go ahead and say that, because in a for-profit system, you need to be able to demonstrate revenue generation. um, Better patient care, okay, fine, that unfortunately actually ends up being secondary to revenue generation. So that's what I've seen and felt and noticed, in various projects. So anybody going into the health tech space, you have to make sure that you have to provide value. You have to really solve a problem, but it has to be financially viable. And if you're doing it for yourself, you will learn this very, very quickly, that you really have to find a way, whether it's reimbursed by insurance, somehow it is self-pay that is enough for you to sustain your product, or in a way that is generating revenue that will sustain you. And if you're doing this for a client or a partner or a health network, perhaps, then the value proposition has to be very clean and clear cut. And a lot of times when that is not the case, it'll be very difficult for you to get your product sold or implemented. So you have to really show your value proposition very, very clearly. Um, and as Howard was talking about the VA probably is a different institution, where they have other incentives to keep patients out of the hospital, keep them better, do remote monitoring as much as possible, handle their behavioral issues as much as possible remotely. So I think VA will probably be a different entity compared to some other non for-profit entities. Um, and Howard, have you worked with the VA, of course, with for-profit entities, and have you noticed this difference?
Yeah, the fundamental is the same in terms of the fundamental desire for care. So that's there, but it comes down to how do you pay for it? And public sector
Yeah,
pays for things and has
exactly,
different.
exactly,
They
precisely.
have different processes in the for profit where the mathematics are, well, they have to pay for it somehow. So either they reduce the cost of something or they got to cut something back. So again, as a vendor, you got to look into what is that payment model. How are you going to get paid? How's your vendor going to pay you? Is the one thing, and the other part. But the other part of it is it's not just the solution. It's not just paying you, getting paid. It's also the effect on the workflows for the clinicians and the nurses. And so the solutions, again, you really, as the technology, you got to really look at so many aspects. You got to look at the workflow as well. As everyone knows, nurses, clinicians, providers are so stressed in terms of the amount of work, especially the staffing shortages. If you've got a solution, had the 30-second rule that takes more than 30 seconds of change in their day, it's not going to be accepted because it's just not going to be incorporated. So you've got to come with whatever solution you provide, it's got to tie into existing workflows or be so dramatic it's actually outside of those workflows. And workflows is you are managing a device or just go back to data or collecting new information. Well, do I have to actually look at a screen to see new information? How do I get to that screen? Is it a new screen? Is it my existing screen? Does it pop up? Does it not pop up? It's like there's so many factors that look into that. But again, It's a practical reality of usability.
Absolutely, and I think 30 seconds is a lot. If I yeah, 30
Exactly.
seconds would be a lot unless it's making a huge improvement in the workflow. Yeah, I think exactly. It has to be really seamlessly integrated. And I think with all the AI devices, all the AI integrations that are coming up, especially in note taking and summarization, let's say for a physical exam or a history, even getting templates for your assessment and plan. I think this will improve workflow, but it has to be right there where the physician or the clinician is actually doing their work. It has to be integrated. For example, if you're working with Cerner, you're working with Epic, you're working with Meditech,
Mhm.
it has to be working with eClinical Works. It has to be integrated with the platform, and you have to communicate with these different vendors, these EMR providers. If you have a new product or anything that's coming in, a remote monitoring help, or a communications help, or a process improvement help, or a clinical feedback
Oh,
help,
absolutely.
anything, it has to be integrated within the product somehow to work with the flow, whether it's in the hospital setting or in the clinic setting.
Absolutely, but
Yeah.
and again, and there's some you mentioned AI. So there's phenomenal AI tools, and I do a lot of work with AI and robotic process automation (RPA) with my clients, doing exactly that back office preparation. So the information is in the physician's hands, but it is important that everyone knows where's the derivation of the AI. Like when it's doing the analysis, where's that information coming from? What are the rule sets? How is it programmed and coded to deal with the bias issues and make sure the guardrails are kept to deal with all these things? So yes, some phenomenal tools, but we're still really early days with
Yep.
AI. Like they're still shooting
Yeah.
darts at the board to sort of go, well, this is kind of
No,
cool.
definitely.
We're doing massive number crunching, but it's as you talked earlier. That's the buzzword of the day. I go to a client and go, oh, we need AI. Yeah, what do you mean? And that's when our discussion starts to go. Okay, let's zero in on what you want.
Exactly. It has to make sense. It has to make sense, but definitely.
Exactly.
Yeah. um I'm going to move on to your role with the hit lab, and as the global fellow at
Yeah.
hit lab, what is this and how is this affecting healthcare innovations? And I know this is a huge part.
Well, it's I've been a member working with them because as maybe familiar, Hit Lab, which is part of Columbia University, do monthly symposium on different topics, and they have twice a year they do larger symposium in New York City. So I've been a part of sort of helping in terms of being one of the speakers or leading discussions or some of the competitions that they do. But at the same time, I've also been a mentor to some of the companies through the HIT lab and working with them to again many points in terms of okay, we got this innovative idea. What do we do with it? How can we get it out? And working with them to sort of help fine tune the solution and help them as they build their business to and evolve out of the hit lab into the marketplace. So it's to be a resource. So your point. So it's active involvement and be a resource.
Right. So, I mean, we are seeing innovations on a day to day basis. Every single day, there's something new that is popping up. But with your vast experience in the health tech space, what innovations that you're seeing that you feel are actually going to be making a change or improving care? What are the trends that you're noticing, especially coming out of your role at the hit lab?
Well, really, and I touched on it earlier. What I think is one of the bigger areas. There's no question. Obviously, it's using AI technologies. Which is basically just massive number crunching at the moment because there's no intuition to it. It's just a lot of number crunching. But it's being able to have better communication with patients and using AI means and some other really kind of cool how familiar they can be and the responses that they do. But the other one is robotic process automation (RPA) that I mentioned earlier. Because really, what RPA is it's instead of Chat GPT, it's behind the scenes and acts as a truly a virtual assistant for the physician. But whatever assistant would do, it collects data from all over the place. So within health systems, outside of healthcare systems, however it's designed. And frankly, the value proposition is saving time. Like to me, the biggest issue with physicians is not their desire to help. It's not the ability to get information and help the clinic. It's just time. And so, frankly, to me, any process right now that helps the physician's time is one of the more dramatic for the next 3 to 5 years. Certainly, is going to be the probably have the biggest impact. And I've seen RPA solutions that are saving physicians an hour a day in clinical settings, which, as you said, 30 seconds was a lot. So imagine you saving an hour a day. Solutions that do that kind of thing, provide additional data, but also save time. I think is actually going to be, as mundane as it is probably going to be the greatest impact on healthcare.
Exactly. And as you mentioned earlier, that you really have to get your end user involved. If it's the physician, if it's the patient, um, bring them along in your whole journey, pre-launch, development phase, post-launch,
Absolutely.
and yeah, and the other thing is you need to find people who are actually doing the work. So I know there are clinicians who know you probably had a great career, but they may be, if they're out of the clinical practice for like 6 months or a year, I do believe personally that they may be a bit out of touch. So I recommend that you do find doctors or clinicians, nurses, nurse practitioners who are actually doing it right now, because things are also changing and they may bring perspectives into your startup or your business idea, that somebody who's been out of the space for a year or two, better than anybody else. And just need to meet these people, and they will be busy, but try to see how you can work with their schedule, and see what can be done. I think that's going to be a huge difference maker in versus with you, compared to your competitor who may be doing the same thing.
Without question, the more you're dealing with someone who's dealing with what they call the trench warfare of healthcare right now and addressing the issues right now, is much more valuable because things are changing so
Right.
quickly.
Yeah.
Yeah, there is a bit of a
Howard, you
delay
have a
I've
couple of
noticed. Yeah.
patents to your name. Can you talk about this from your perspective, as well as how could a startup look at patents, if they're looking to go for one?
Yeah, yeah. Actually, I have, really, to me, it's crazily. I have eight. I've been awarded 8 patents so far, and it's, based on the original idea that's expanded into other ideas. But the whole strategy of getting a patent is two elements. One is getting the patent, the cost and the process of getting the patent, which is nice. The other part of it is, okay, once you have the patent, you have to be able to defend the patent. So one is a business that's hundreds of thousands of dollars. The other, if you're defending, is millions of dollars. So when I was a certain the early startup phase, I looked at the patent as being a business and marketing process to sort of go, who's this little company going against some larger companies, going to large health systems? Where's that value proposition? And one of them was the ability to say, well, I do have patents on this kind of process and this technology, which gets attention. So I looked at it as a marketing expense, frankly, when I started, to sort of say, okay, this I could market this as an ability of what we have that's unique. Because always the question is, you go in any room and you talk to any client and they go, I've spoke to 10 of you today, because everyone's pitching similar things or using similar buzzwords. And so one way of providing a unique perspective is to say, look, I've got this is protected intellectual property, and that gets attention. So I said that. So it was really more as a business approach to be able to sort of create a differentiation. But it can be a long process. Frankly, the first patent took almost 8 years.
Howard, that's great. Howard, you mentioned that it took 8 years for your first patent, and then you had the 8 years, yeah, and then you had
Eight
seven
years.
rolling out
Yeah.
after that. So the following patents must have been much easier. But to help somebody who is looking for their first patent, what would be the recommendations or the advice that you can share with them, since you've already gone through this multiple times?
Well, like, and for all these things, as I did when I sort of came in the industry, research is really important. So when you're filing for a patent, for example, the first thing you do is go to the U.S. Patent Office website and search what's been patented or what is pending as a patent, and just your keywords about your idea. See what's out there, because the two tests for the, on a very simple basis, the two tests for a patent is it novel, is it unique, is it novel, is it a novel idea, and is it obvious? And novel is, okay, has this ever been done before or thought of? That's checkbook one. And the second one is an obvious. An obvious test is basically if you took this patent and this patent and this patent, would you result with what you think is your patent? And if the patent office says that's what happened, is your obvious, you fail the obvious test. So you really need to see what's out there in terms of those unique elements and unique proposition, which I did for the first one. But once I went through that process, we got a better sense of exactly how they're looking at health IT in particular, because it was so new then. The people doing the analysis were kind of looking at, didn't know the same way of what they're looking at and how to. So we had to learn how to describe these things in a way that the patent reviewers understood. But at the same time was the ability to discern that unique element. What is different between this? And frankly, working with really good patent attorneys
You're right.
makes a huge difference. And so in that 8-year process, I had one set of attorneys and that I fired, I dropped. And my second set of attorneys got me the patent in 8
Right.
months.
What stage, at what stage you recommend hiring a patent attorney or anybody else?
Well, it is an expensive proposition, but the really is the earlier, and it doesn't have to cost you very much for the early discussions with them. It's not very expensive at all, and filing a provisional patent is very inexpensive. But you want to do as early as possible because in the protection of your idea, because the moment it's public, you literally have 1 year to file a patent, and otherwise you've lost it. So you really want to get advice as early on, or somebody who at least who's familiar with the process as early on to get an idea of what you should discuss, what disclose in public, what you want to keep private, and how to go about that process and walk you through it all.
Right. So provisional patent, yeah.
And a lot of the patent attorneys out there will certainly, as a certain as a start, will give you, they'll talk to you, give you first, consultation, not charge you anything, just to help get a sense of what you have and what process to go through.
You mentioned about the provisional patent. Do you recommend everybody goes through a provisional patent process?
Well, the value of the provisional process is it allows you to actually do the work and get a sense of where you're at, and allows you to sort of say, okay, at least you're putting a pin on it to sort of say, okay, this is now temporarily protected until I do my full, and you have 1 year to file your full patent. But it's a very expensive process, but you still go through a lot of the claims and all the elements of it, but it's a much less expensive process, and at least gets you the ability to say, okay, I'm doing this before anyone else is. So it's a very good, I certainly highly recommend it if you're going to go through the patent process to do so. And learn, because it's an inexpensive way of learning what you're going to get yourself into.
What can you share the costs involved with the provisional patent and then the subsequent filing for the patent?
Well, it really depends, frankly, on how you're doing it and who your attorneys are. So it can be, as you know, filing for a provisional, maybe $5,000 or $10,000. The full blown patent can cost hundreds of thousands, depending on the process and how many times you go back and forth with the patent office. So there's a wide range, but it's not for the faint of mind.
And have you found any, I don't want to say shortcuts, but are there any shortcuts that you can possibly share? For example, hiring somebody, in a different country perhaps, to help you go through the process, who is familiar with the US or the Canadian process, and use attorneys at the very end. Are there any basic tricks of the trade that you have encountered or benefited from?
You're not precluded from doing it yourself. So you can certainly go through and find people who've done experience with having done filings, um, to start the process. Certainly, like I kind of, my approach was just, frankly, it was so foreign to me. I just, I'd rather, if I was going to do this, I was just going to do it in a way and just have the attorneys do it, because I have no idea who, I had no ability of knowing who someone was doing it right or wrong in the first place. But there's no question that there are people out there who can help filings and help do these things. that are not part of large law
Yeah,
firms.
that's a valid point. And anybody, going into anything. Yeah. Yeah. That's a valid point that especially if you don't know how something is done and it is completely foreign to you, hire somebody, whether it's local or somewhere else abroad. Hire somebody that will, of course, keep you one. It will keep you in check. It will serve as you will feel a bit more accountable. If you have paid somebody, it doesn't matter if it's thousands of dollars or hundreds of dollars, depending on who you hire and where you hire somebody from. But just like with anything, you don't want to limit yourself and waste time trying to reinvent the wheel. Learn it from somebody who has done it or at least knows about it. And instead of it taking you, a couple of years to do something, you end up doing something in maybe a few weeks.
Exactly.
Yeah, that's the approach, I think. But if you don't know anything, find somebody, hire a lawyer. If you're a big business, hire the best lawyer to do that thing for you quickly, for whatever that you're looking to do.
No, exactly. In fact, that's when back to my backstory about going from a film producer to health tech. I actually brought on a board of advisors, people who were in the industry, who are thought leaders, to walk me through what was involved and to really be my educators and mentors to teach me, so I knew what I was getting myself into. So it was not totally blind. It was more having that same kind of thing, having a support system. So I knew I at least had guidance as to what to do and what not to do. More what not to do than what to do, but makes a big difference.
Definitely. Howard, a lot of people are these days, they talk about work-life balance, and the demands of a high functioning individual, and who wants to actually get things out there and maybe change the world or small aspects of the world, right? What do you think about the concept of a work life balance? Is that something you go for, or you are completely against this?
No, it's absolutely crucial to have that balance, in part because when you're an entrepreneur, you're pulled in a thousand directions, in a thousand different ways, a thousand different times through the course of every hour, let alone during the course of the day. So you need to have that time, that balance to sort of not, certainly reflect. But I found what happens is if all you're doing is go, 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 you're doing 95, 100 hours a week, every, weeks, you don't have a time to reset yourself. And I found by creating a bit more of a balance, that actually allowed, I was more efficient and more effective by having a balance than I was when I was going, a million miles a minute, because the subconscious continues the thought process, certainly, but you get clarity when you're taking your mind off the specifics and just let processing occur. And ultimately, you become more efficient, more valuable, deal with more of your issues, by being able to uh, create that balance.
Yeah, I know a couple of people who worship their weekends. Their weekend is their safe spot, and that is
Yeah,
untouchable. Um, People dedicate their time for family purposes. Okay, this is
yeah,
it, and that's going to be it. Unless there's, of course, something really important happening, you will, put it off, and that email has to wait. That response has to wait. um, and but then there are other people that I've seen that they just don't turn off, and that's how they work. That's it, and they just can't turn off. So everybody's different. Whatever works for you, I think, really, you need to find whatever works for you that can sustain you in the long term, for the long term, because this is not not going to be doing this over the course of a week or 2 months. It's going to be a long slog. So whatever works for you, figure that out, and I think that should be good. Howard, failures, setbacks, have you had any? Have you learned from them? What has been your experience? And if you had significant failures, how did you actually overcome them?
I I'd be surprised. Lots of people will say they haven't had failures. I'd be surprised that they hadn't. Maybe they've forgotten them. It's like the road is always, it's a rough road, can be a very rough road, and so there's always twists and turns that are unanticipated, and so certainly there's failures along the way. But as I actually came up the other day, and I wish I could remember who said it, That probably several people have said it, but the reality is, you do, and as trite as it sounds, you actually do learn a heck of a lot more from a failure than you do from success, because you get to do a proper analysis, going, why didn't this work? And you have to do a deep dive to understand why. And you do, and it's the lessons learned from that that makes such a difference going forward, to ensure you don't do that again, or to learn what that process was. If you have success, there's nothing. Yes, it's great. No, believe nothing wrong with success, but there's no lessons learned from the success, because whatever you did worked, but it doesn't mean it'll work all the time. There's not the same kind of analysis. Whereas a failure, it's stark as to what didn't work, and you can really, it helps you build a more tangible road forward.
Definitely. So, people talk a lot about rituals and self care practices. A lot of people believe strongly on certain rituals they have to do when they wake up in the morning, or before they go to bed, or on the weekend, or Sunday evening. Do you have any particular rituals or practices that you strongly hold on to?
Well, the key one for me is to start the day as I try, and I'm not perfect at this, and you can just ask my wife. But what I do is I try to actually exercise every day. Start off the day, even 30, 45 minutes. There's some really great programs just to sort of reset myself. And I can't think about work because I'm busy doing a horrible exercise. And today was no different. But that kind of helps to sort of set the day, because I have no control. I have no control what's going to happen during the day, but for those 30 or 45 minutes every day, I'm in complete control over what happens. It's my decision. As much as I don't like it during it, it's my decision to do that. And just having that sense of control makes a big difference. So at least I've got it's centering for the day.
Right, true. Stepping back a little bit, Nova. What is Nova? Can you talk a bit more what you're doing at Nova?
Well, Nova came out, as I mentioned, I was the technology I had. So in 2005, I founded a company as a solopreneur, then entrepreneur, then built a business um, around it. And during COVID, when it started, I made the decision to sort of step down, kick in succession of the company and step down, and really say, where would I want to go with all my lessons learned, frankly, from the film business as an MBA, and with health tech. And it was really to take what it built in terms of engagement and communication and try to take it to the next level, working with others in terms of solutions, building a consultancy that deals with the digital transformation, but the concept of humanizing digital transformation. Because technology for technology's sake doesn't help. And as you talked about as your theme, you got to involve the stakeholders, but so few people do that. So it's really the consultancy zeroes in on working with our clients to actually deal with that transformation piece. At the same time, I've been building up our practice in terms of getting more specialties in the area of artificial intelligence, robotic process automation. And recently, I've been working with companies in Europe and bringing solutions to the United States and Canada. Like actually recently announced, it's recently announced in terms of actually having an RPA product out of the Netherlands that I think is kind of cool. And we just announced a online education platform for teaching telehealth out of Ireland. So it's really to create these solution sets, but to be able to do all those pieces that I thought as a vendor of a particular solution I was limited in, and frankly the arrogance of being able to go, well, actually now I've opened up the world, and working with other solutions and other clients in other ways, utilizing what I've learned over the years.
No, that is very inspirational. What would be your personal mantra or philosophy that helps you stay focused and resilient in this continuous journey that you have?
Well, it's a two. Well, there is.
If there is a
Well,
mantra
actually,
or a philosophy that you
it's
stick
a
by.
two-step process. Actually, one is, and I tell these to the companies I mentor, is that if you have an idea or a thought or a process, um, the more vehemently people say it's a bad idea, you may be onto something. But at the same time, be sure to actually check with the stakeholders that they actually think agree with you that's a good idea. So you want that balance between the two. Like you want to be resilient and forthward, and I've got this great idea, and just keep your mission clear. But at the same time, you don't want to be foolhardy.
Great. Yeah. You have to be directional as much as possible and be ready to be flexible if needed.
Exactly. Exactly.
Um, so, Howard, we're going to be moving towards the rapid fire round.
Okay.
The first question, and this is what I ask everybody that we have on the podcast. If you were made the president or the prime minister, possibly in your sense, since you are in Canada right now, if you were made the president and you have no restriction, you have no cabinet, no House, Senate, nothing else, and you are able to do whatever you want, what is the one thing that you will do?
It's an interesting question because there's so many things in there. Frankly, to me, is to actually not just talk the talk, but actually give access to care to patients anywhere they happen to be. So it's not just say you want to do it, actually get that done. Because the more you can give access to care, the more prevention, that'll actually make things so much easier, and frankly, across the whole healthcare system. And a healthier population would make a huge difference. So instead of just talking the talk, actually walk the walk.
Three best tips or recommendations that you will provide that you want to suggest to healthcare startups and entrepreneurs. What would those be?
Well, as I said earlier, frankly, the first one is, as I mentioned, the more vehemently people say no to your idea, the more you're onto something. So the second part of that is check with the stakeholders and your prospective clients to make sure they agree with you that it's a solution, it's a problem and a solution to be solved. And the third part of that is actually making sure it's a priority problem and solution.
Definitely. What is one book that you recommend people to read?
My favorite book, and it drives people crazy, came out of university when I was in university, and it was actually the Peloponnesian Wars that takes place. It's a Greek. It's the second history ever written, and it's a war between Athens and Sparta. And it's a really thick book. But to me, I learned more life lessons out of that in terms of the story of the battle between these two city states, but also how history repeats itself, or doomed to repeat itself, or destined to repeat itself. And I still found it's still to date, it's still been the most, had the one thing that comes to mind almost on a very regular basis are those lessons learned. And it was more than 2 years ago that I read that the first time.
Right, great. No, that is truly, I mean, history has been repeating itself over and over again. It just as we have to realize
Yeah,
that, okay, yes, this is going to repeat.
exactly.
Don't make the same mistakes again if possible. It's difficult. Yeah,
That's
don't.
absolutely the case. Yeah.
Yeah, exactly. What is the best quote or phrase that inspires you?
Oh, you know what? My screen is off. My favorite quote is actually Teddy Roosevelt that talks about it's basically the theme in the about the battle to become an entrepreneur is really what it comes down to. And really, it's it, the again the paraphrase of it is a lot of people are going to be critical of you, and a lot of people are going to put you down, but the vast majority of people have never done what you've tried to do. And so hold your head high that you're actually at least trying to do something as opposed to sitting in the background and being a critic.
All right. Elon Musk or Mark Zuckerberg? Who do you prefer and why?
Could I have a third choice?
Okay. Okay,
Well, no,
let's
let's put this.
say
Let's actually this. Yeah,
let me throw
it's
in some.
if the discussion is on entrepreneurial side and investment in entrepreneurship, it'd certainly be it'd be Elon Musk just in that narrow description because of his investment in a variety of entrepreneurial activities. Zuckerberg has been uni focused on just effectively what he's trying to do with Meta. On a broader sense, I don't agree with those individuals in other areas, but the Elon Musk's investment in different technologies, in different innovations, is something that part is cool.
All right. Last question. how is AI going to be in the next few years in health tech?
Oh, it's going to be pervasive. It's going to be the overriding element in terms of, because it's a process, it's processing. It's all it is information processing. So it goes to that I've mentioned this a couple of times, that fire hose of data. So the value proposition is going to be the processing of that data, laying on the rule sets of the providers you're talking to provide additional information. It's still an assistant. It's not going to be the lead. It'll always be, here's some suggestions, here's an assistant side of it. But I think it'll be extremely valuable, and it will be pervasive. Everything, marketing wise, everything's AI already. But the practical reality, there'll be elements of that processing model, because all it is technology. It's just processing information. So it will be pervasive.
Yep, I think that is an understatement. Howard, where can people find you?
Well, I'm at LinkedIn at Howard Rosen 129, or certainly feel free to email me at hrosen at novapix, novapix.com.
All right, great. So, Howard, it was a pleasure having you, and I hope we can do this again sometime. Thank you so much. Thank you so much for being here.
Umar, thank you so much. I really enjoyed the discussion. Thanks.
I appreciate you as a valuable viewer, and thanks for watching till the very end. If you liked this, check out this podcast. I know you will love it. You can also check for more interesting links in the description. I'm Dr. Umer Khan. Looking forward to seeing you again. Thank you.